going to discuss with you some symptoms that people get from wearing improper footwear, such as flip-flops. Sometimes people get stiffness and pain in the back of their ankle, which is a result of Achilles tendinitis, which is inflammation of the Achilles tendon or degeneration of this tissue. It could be a gradual onset or a sudden onset of pain, but if not addressed properly with appropriate stretching and strengthening or going to physical therapy, it could become a chronic condition that becomes much harder to treat. Other issues that may create this pain could be training on soft surfaces, running uphill, or just general stiffness and tightness and foot biomechanics. There's a few different stretches and exercises I can show you that you can try to help diminish symptoms and get back to full recovery. One stretch that you could do to stretch out the back of the ankle would be to go up to a wall, put your hands on the wall, and put your affected foot behind you. You want to make sure your toes are pointed forward and your heel is on the ground. You're going to lunge forward with the opposite leg until you feel a stretch in the back of your ankle. You're going to feel that stretch and hold it for 30 seconds, and you can repeat it 3 to 5 times. You also want to do the exercise with your knee in a bent position as well, and do the same thing, hold for 30 seconds and do 3 to 5 times. One strengthening technique that helps with this injury is eccentric strengthening, which allows the tendon and the muscles to lengthen while you're strengthening. So what you do is you'll go to the step. If it's your left leg that's affected, you're going to raise up using your right leg, and you're going to lower down using your left leg just to neutral. You're going to go down nice and slow, so you're lengthening that muscle as you're strengthening it. You're going to repeat that 3 sets about 10 to 15 times and try twice a day. Another technique would be a self Achilles tendon massage. You're going to take your thumb and your index finger and go along the tendon until you find the point of the most pain and put moderate pressure, and you're just going to massage that area. You can move the tendon around, up and down, and even pump your ankle up and down to get a nice friction massage on that area to help disrupt the tissue to promote healing. You can do it for about a minute or 2, and this will help. Do it a couple times a day to help decrease that inflammation and pain. If your symptoms persist, call any of our offices to set up an appointment to get evaluated by your physical therapist and get further treatment.